So the question is, why now? This has been going on for a while, why now? Well, because the face of America is changing rapidly. By 2042, we will become a majority people of color nation. Not only are we experiencing this racial demographic shift, but we are also aging more rapidly as a nation, as you all know here in New Hampshire. 2011 was the first year of the age wave, with an American turning 65 every 8 seconds. That's 10,000 people a day, 4 million people a year, okay? That's why we have to act now. Due to advances in medicine, we're living longer lives. So the number of people who will need care just to meet their basic daily needs is going to skyrocket over the next 20 years, and we're already starting to feel it. And when given a choice, most aging adults choose to live in home, in the communities that they built. When given a choice, most people with disabilities choose to live at home in the communities that they've built. Every one of us in this room has somebody in our family that's grappling with these issues of care and aging. And more of us will need long-term care in the coming years, and older Americans will increasingly rely on younger immigrants and people of color as caregivers in many parts of this country. So by 2040, nearly 30 million Americans will need direct care. That's 30 million people will need direct care. And yet we haven't made the policy and economic changes to keep up with the caregiving needs of our nation. Because the quality of jobs in direct care is so poor, we cannot sustain the 3 million people working in caregiving fields in the United States today, whether it's as home health aides or nannies or housekeepers or elder care assistants. These workers are disproportionately immigrants, and they are disproportionately women. 89% of care workers are women in the US today. Almost half of care workers are paid less than the legal minimum wage. And even those who make minimum wage don't receive the required time and a half overtime when they work more than 40 hours a week. With annual wages averaging below 200% of the federal poverty level, more than 40% of home care workers must rely on public benefits such as food stamps and Medicaid, which are a few of the many vital programs, as you all know, that are currently under threat from budget cuts. So the people who are caring for our children, our elderly loved ones, those with disabilities who need extra assistance, the people who are caring for our nation literally are not paid well enough or given the basic legal rights to care for themselves and their own families. There's something really wrong with that. This is why we have to act now, because not only do we need to make sure that we can have access to good, affordable care for our loved ones, we also want to make sure there's a workforce that can actually provide that kind of care. In a moment of these demographic changes and a discourse on income inequality, we have an enormous opportunity to shape the care economy in this country. The campaign is rooted in a set of values, the values around promoting and supporting intergenerational relationships, an understanding of and appreciation for interdependence, ensuring that the people we love have access to the quality care they need and deserve, and that the caregivers who provide this care are treated with dignity and respect and have good quality jobs. So the question is, how are we going to do it? Well, we believe that we need to build a movement, and we need to build a movement of what we call the caring majority. If we build and engage a powerful caring majority that can win on key issues, we can do that through policy change, through culture change, through organizing. We can have the best possible policy vision, but it will go absolutely nowhere without changing the political will of this nation to transform the system of care. That's why at Caring Across, we're committed to building a culture change strategy that allows us to build a much broader movement for change. We have all these challenges, but we have enormous opportunity here to build and shape our communities, our country, and our future to meet our basic human needs. That's why we have to spark this movement now. And I look forward to partnering with all of you as we transform the way we care in America. Thank you.